What do you think, Dylan? Are you ready to go? All right. Okay, well, let's get started then. So, hello, everybody. My name is John Butler, and I'm the project manager at CARB for this project, which is to update the CARB policy briefs on greenhouse gas emissions and vehicle miles traveled reduction strategies. Welcome to everyone here today. We will have live questions at the end of the seminar. However, if you want to type your question into the Q&A function in Zoom, the researchers may be able to answer it in writing as we go along. If they answer your question in the Q&A function, the answer might appear to everyone in the session. Because we're using the Q&A function, we're not using the chat function. We will enable raising hands during the Q&A session at the end of the seminar, but not during the presentations. My email and the principal investigator's email are also in this presentation, which you'll see later on. And you can email us if you have further questions, but I will not be monitoring my email during this seminar. The session is being recorded, and you will be able to access the recording in a couple weeks on the Policy Briefs page on the CARB website. Next slide, please. Our meeting today will focus on Policy Briefs findings from the research team. Before that, I'll do a quick introduction to the project, and the principal investigator at UC Davis will give an overview. Next slide. This is a CARB research project to update existing policy briefs and add some on new topics. The policy briefs synthesize the latest research on a variety of topics that are applicable to sustainable communities and SB 375. One important enhancement to these briefs is a more intentional integration on equity considerations compared to the last version. As I mentioned, my email and the principal investigator's emails are here for later contact. Next slide, please. The existing briefs are available on CARB's website. I pasted a link to the page into the chat earlier. I'll paste it again in a few moments when Dylan starts talking. Some of the new briefs are already on this webpage, and the rest will follow as they are completed and made ADA accessible. So we're making good progress, but we haven't got them all yet onto the website. Next slide, please. This project began in 2022, where we developed a long list of potential topics. In 2023, we refined that to a short list, created a template, and then Dylan assembled a team of researchers and equity advisors. Since then, the research team has been drafting the briefs. Draft briefs have been reviewed by people in CARB and other state agencies who have indicated their interest. A big thank you to all the reviewers, as well as the researchers and the equity advisory team. Next slide, please. This is the list of new and updated briefs. There's a lot here, and I won't go through each one because the researchers will be discussing the findings for all of these briefs in a few minutes. And now I'll turn it over to the principal investigator, Dylan Fitchpulse. Dylan?
Thanks, John. Good afternoon, everyone. Thanks for joining. So the first thing I'd want to just point out is that this is a really large team effort. So thank you to John for your support throughout the project and all the reviewers, to Seth, who's working very hard right now, making sure these briefs are ADA accessible. You can see the lead author team in the middle column here, and then the equity advisors. Some of the lead authors will speak today, and equity advisors as well. So I thought I'd start by talking a little bit about the project's process and a few changes that we made along the way. So as John mentioned, the part of the project was to have a more intentional look at equity. And during this process, we decided to add some greater communication pathways from the authors and the equity advisors. So some of that happened before the briefs were written, not always, but often, and that helped streamline the inclusion of equity concerns into the brief. We also added meetings between the authors and equity advisors as necessary during the editing process. So even with all of this, we essentially ran out of time and money to do, what we fully wanted to do in terms of equity reviews. So some of these briefs have had gone through one level of equity review, some two, and I think for going forward in future work, it's important to plan for, the real time and effort that it takes um, to do this work. We also added a series of production steps to ensure these documents are accessible, and that's kind of where we are right now. We're revising some of the last few briefs and then making sure they're accessible. So in updating the briefs, we and some of the new briefs, we start this as a research synthesis. So this is a literature review, but it's not an exhaustive literature review. So you can think of it as targeted searching by the author who has the expertise on the specific topic, and you'll see that the team is broad because there are a lot of different topics, and some authors have certain expertise. So the goal was to select the best studies, both from internal validity, so which studies were likely showing the cause and effect relationship between a certain VMT reduction strategy and VMT outcome, and then also studies that had good external validity specific to California. So we focused as much as we could on studies that we thought were most applicable to California. We did this synthesis by documenting kind of four categories of information. The first being the effect size of the strategy. I'll talk about each of these in a moment. The extent to which the strategy could be applied across the population, the synergy with other strategies to reduce VMT, and then also, as mentioned before, the equity of the strategies. So for effect sizes, we were primarily looking for percent change in VMT for some unit change in a given strategy. We didn't always find that. And for many of the strategies that were written about back in 2014, we knew going into this that not all the strategies were going to have evidence directly linking them to VMT. So the units of strategies were often very different too. I'll make this case many times that it's very difficult to compare strategies, and partly because of that. So some of the strategies also had outcomes that were related to VMT. And so you will see, for example, some of the transit strategies that focus on, say, transit ridership, because the literature didn't have a close connection to VMT reduction. But the idea is that we looked for the outcomes that were most closely related to VMT reduction. Even within a strategy, there were different measurement techniques, which made comparisons between studies really difficult. And of course, between strategies, there can be quite different. So then moving to the strategy extent. So this is essentially asking the question, how wide of a population could the strategy impact? So you could, for an example, you could have a large effect size and a small extent. So this example would be like a travel behavior change program at one employer. The evidence suggests that these programs have a really strong effect on the employees at one employment center, but it's implemented at one employer, right? So the ability for it to affect, say, a city is pretty low. So that's the extent, unless other employers are doing the same thing. And then the reverse could be a small effect size with a large extent. So, for example, increasing employment density doesn't have the largest effect, but if implemented throughout a city, it can impact an entire city, and so the extent could be quite large. We also tried to consider the potential speed of implementation during the discussions of strategy extent. For synergy, we focused on what other strategies worked with the current strategy that the brief is discussing. So for example, travel behavior change programs will be more effective if they're done in concurrent with public transit, walking and biking infrastructure, or incentives. In equity, we aim to report direct and indirect effects of the strategies on social equity and justice. But in many cases, the evidence is not in the same literature that the VMT reduction evidence is in. And in many cases, for these strategies, there's likely little research yet to do yet done on equity impacts. So if studies didn't contain that evidence, we created a starting place to consider equity and justice going forward for these strategies. So this starting place considered comments from the Equity Advisory Committee, other sources of information that we could find on the strategies with regard to equity and justice. And I think that's the most important point is that in many cases, we're calling for more research, specifically research centered on equity and justice within these strategies. We also tried to consider the context for the strategy. So, for example, um, in cases like in rural communities, some of these challenges may be compounded purely because of the context. So, it's not specifically the strategy, but it's where the strategy is applied. Okay, so let's get to some of these briefs. So, we have a bunch of authors here, and we're going to step through. I'm asking each author to talk for no more than, we'll aim for 5, no more than 8 minutes on the briefs that you're leading, and then we'll work through them all and briefly, and then we'll come back and get some comments from the equity advisors, and then question and answer. So is Susan Handy here? I think
She will be at
she
least.
will.
I just promoted her. I think she's rejoining as a panelist.
Okay, so Susan led authorship on car sharing, employment density, mobility hubs, telecommuting, and urban growth boundaries and land conservation. So, Susan, I will move your slides and you are welcome to start.
Great, thank you. And thank you everyone for being here. So employment density, let me start there. The research suggests not very much of an effect, and that the effect depends on existing employment density as well as the quality of transit service. Probably where this strategy has the biggest effect is in areas where you have currently relatively low job density and in general poor access to jobs in those areas. So if you put more jobs there, you're likely to be providing an opportunity for people to have shorter commuting distances. If you put more jobs where you already have a lot of jobs, you're likely to be increasing people's commute distances. So this one really depends. Next slide. Telecommuting is also more complicated than you might think. So clearly there's a reduction in VMT for workers who are telecommuting on the days they are telecommuting. But that reduction in VMT is offset to some extent by increases in non-work travel by the telecommuter and can also be offset by increases in driving by other members of the household. And then, of course, the other thing that complicates this is that the ability to telecommute can have an effect on where people are choosing to live, so that you can end up with a situation where a telecommuter is commuting longer distances on the days they are telecommuting than before they were able to telecommute. So again, how this plays out in terms of the net impact on VMT is not entirely clear. And part of the problem here is that most of the studies are cross-sectional in nature, so they're just simply comparing people who telecommute and people who don't, rather than looking at how VMT changes when somebody starts telecommuting. And most of the studies are pre-COVID. So of course, things are very different now from the standpoint of telecommuting. And there are new studies in progress, and I'm sure there will be more soon. So I suspect that this is one we will be, or somebody will be updating before too long. All right, next one. Okay, land conservation, another complicated topic. So land conservation in and of itself, where we are in some way setting aside land and protecting it from development. Um, on its own, it's likely to have either no effect on VMT or could have or lead to an increase in VMT if by preserving some tract of land um, that is sort of forcing new development to leapfrog farther away from existing areas. But if land conservation is used as a part of a growth management program to help enforce urban growth boundaries, that can help to ensure a more compact city. And we have good evidence that more compact cities have lower VMT per capita. So if used in the right way, there could be a VMT reduction. But we just don't have the evidence to have a good way to quantify this. All right, next topic. Car sharing. Um, this one might seem a little funny in that car sharing is about providing people with access to cars who might not otherwise have access to cars. And that can be a very important thing from an equity standpoint. How it might reduce VMT is by leading to lower personal car ownership. And we know that lower car ownership is associated with lower VMT. So evidence does suggest that there is a reduction in car ownership and VMT for members of car sharing programs. So that's a positive thing, and we've got some numbers on what that reduction might be. But a couple things to note, it's going to be most effective in and most popular in areas where there are good alternatives to driving so that people don't feel like they need to have a car for all of their travel. And last but not least, mobility hubs. So by mobility hub, we mean a transit center that also has good integration with other services like bike share services, car share services, other means of getting around, sort of all connected within this single location. Sometimes they also include various kinds of public services, which can be a boon to equity as well. So here we just don't have studies yet. This is a relatively new concept, and some of these have been built in various parts of California, but we don't have good evaluation studies yet of what kind of impact they've had. And that's it.
Thank you, Susan. Okay, moving on. Andre, you are up with jobs, housing balance, residential density, road user pricing, and VMT fees.
Yeah, hi everyone, and apologies, I'm going to stay off camera because I'm on my phone. But yeah, going through these. So residential density is a straightforward concept measured as number of people per some unit of area, usually square mile. One of the issues here is that even though it's a study that has a lot of a long history, we don't have great ways of measuring change because change in density is slow. And so the impact is usually also quite small. The other big issue with this area is self-selection, and the fact that people will select into denser areas because it provides the ability to drive less. And so we aim to select studies that took that into account, and you see the high range of effects is for studies that take self-selection into account and puts the reduction at about 22% for a doubling of density. Next. All right, so road pricing here, I'm going to talk about two types of road pricing. So I'm going to aim to make the distinction clear. This one is focused on tolls and cordon pricing with a small segment on heavy-duty truck distance-based pricing. I'm going to focus on the tolls and cordon pricing. And what we found is that both the tolls lead to a small decrease in traffic volume. So both types of pricing are led to volume rather than VMT, because it would be difficult to measure VMT based on going through a toll or a cordon. And so the tolls tend to lead to small decreases in volume. Here we find usually a decrease of around 3% as a result of a 10% increase in the toll fee. Cordons tend to be associated with larger decreases. What's interesting in existing studies, which are mostly based on other countries, because the first cordon pricing in the US just happened this year in New York City, is we find a strengthening of the effect of the cordon if transit is available as an alternative, right? So people are mode switching from car to transit, leading to a further decrease in traffic volume crossing the cordon. Next. All right, so as I said, we focus on two different kinds of road pricing. This one is the other one, which was meant to be focused on distance-based charges, but there's not much research on distance-based charging because it's not really implanted at scale anywhere yet. So as an analog, we looked at gas taxes specifically where possible. Here, one thing I will point out is gas taxes, the research on it is quite contentious, right? Estimates tend to vary quite a bit based on the method that people have used to isolate the effect of taxes as opposed to gas price overall. Right, we know that gas price is quite inelastic. It leads to small decreases because people have to drive usually, and this effect varies by income level more than overall. With lower income, people being more affected by increases in gas prices. But gas taxes is something that there's quite a bit of a disagreement, with some people having very large estimates and some saying it has no effect at all. So not really a good, reliable estimate on that, which leads us to there's quite a bit of uncertainty as to the effect of distance-based charges, depending on how it's implemented, whether it really is replacing a gas tax or implemented with more flexibility. For this, we also looked at TNC charge as another strategy that is use a similar logic. And here again, we cannot measure VMT really, and few of the fees that exist are based on VMT or as a travel demand management tool. So most of the effect is on the number of trips that are booked on transportation network companies. And what we see is the expected decrease. Again, it will vary by depending on the strategy that each city or state uses, with some states using kind of a flat fee and others like Chicago using more of a congestion pricing method, and therefore having more of an effect. All right, next. All right, and the last one we did is focus on job housing balance, or as we kind of made the argument, what is more and more called jobs housing fit, right? So job housing balance is just the balance between housing and jobs, or the ratio of the number of jobs to the number of housing units, with the hypothesis being that if people live closer to where they work, they will have to travel less. What people have found over time is that this is not a great measure, because if people live in an area where the jobs they need are not present, say if they are lower income and they have to travel a long distance to find the type of jobs for which they qualify, then it could have the opposite effect. And so job housing fit is really designed to capture this imbalance between housing affordability and the types of job people can work in. And so there's been a movement in research to go towards that measure of job housing fit. Again, here, there's some challenges in measuring VMT, and studies have often inconsistent measures of outcome. But what we find is usually either insignificant or small decrease in VMT with some variation. And for general housing fit, also a larger decrease, but this is for one standard deviation. So the impact is based on the larger change. Yeah, so I think I'll wrap it up here and leave it to the next person. Thank you.
Thanks, Andre. Okay, now I'm going to hand it over to Susie Pike to talk about microtransit, seamless transit, ease of payment, TNC transit partnerships, and then transit fare policies, including free transit fares.
Thanks, Dylan. Hi, everyone. Just, I guess before I start, I think as Dylan mentioned at the beginning, for a lot of the topics related specifically to transit, a lot of the time we don't estimate, a lot of researchers do not estimate VMT outcomes as they relate to various changes in transit. More research does relate to transit ridership, so just quantifying the volume of people that are using transit, and that can relate to VMT changes in various ways, but is, I think, an understudied area overall. And then in some cases, the studies also, we use changes in transit use at the individual level as the outcome variable because we can't track, because VMT hasn't been tracked in the studies. So starting here with transit fare policies, in this brief, I focused on programs where the cost of using transit is either completely free to the traveler or some kind of reduced fare program. And this could be covered by any entity. Some of them are covered through university fees of students. Some of them are covered by the transit agency themselves. There's various mechanisms, but the idea is that the customer, the traveler, doesn't pay. And unfortunately, there's not a lot of research on these programs, in part because there aren't so many of them implemented. But what there is a lot of research on is actually the change in transit use or ridership related to fare increases. And so the elasticities that are shown here are for fare increases, and they range from, the kind of common rule of thumb is about 0.3 or negative 0.3, where ridership goes down in response to the fare increase, and then all the way up to kind of negative 6 or 7 in terms of a decrease. And then in some cases, though, we saw studies where there's complete removal of fares, and so ridership can increase and or transit use can increase in a huge array of values, right? From like a small percentage, 32% to 200%, and then at the individual level, it can be, one additional trip per week or things like that. Some of the kind of conditions under which these changes are most effective can be in times when the initial fares are fairly low as an initial condition. Reducing them further isn't likely to have as big of an effect as areas where the fares are higher. That's kind of intuitive, I think, but there was one study in a different country actually where they looked at that. And then as far as the synergy and equity, certainly making free fares is helpful, but also enhancing service in different ways, like making it more frequent, can be important as well. Sorry, I guess that's more of the extent. And then in the synergy, there are some impacts, right? If no one's paying, it can make everything a little bit more efficient. And then in some of the university-based programs, I think there's this kind of reinforcing cycle. If people are using transit more, there was one study where they were talking about that not requiring the construction of a parking garage, and then that could then kind of further the effects of fewer people driving and kind of reinforcing the use of transit. All right, I think I'll go to the next one. So for seamless transit, this really encompasses lots of different strategies that agencies might use in order to make the use of transit more efficient or more simple for travelers. So This includes everything from providing real-time information about the bus location or the transit vehicle location, to integrating with other kinds of services, um, and then things like the way that people pay, making it more efficient for people to pay, things like that. So I did focus a bit on these two things of integrated fares and real-time information because there was a lot more research on those topics, with some effects ranging from about 2 to 18 or 19% increase in unlinked trips. So this is the boardings, right? It doesn't account for the fact that people who are making a transfer is one trip. These are each individual unlinked segment of a trip. And then, a fairly large range from about 1 to 17% in terms of the real-time information. So when you know where the buses are, you're maybe more likely to ride them for a number of reasons. And those things included just reducing stress and having more reliable service or more reliable knowledge about the service. And then as far as when these are effective, some notable impacts were like considering things like commuter rail, where real-time information may not be as important if it's a rail service that's consistent and people are using it regularly for commutes, versus bus services, which tend to be a little bit more variable because they're often in traffic, and potentially used for shorter trips. So that real-time information could be more important. The synergies, including reduced stress, right? And all the things that might increase transit use when paired with other efforts could strengthen the impact. And certainly these strategies can have a positive effect on equity if they make the system easier to use for everybody, although some of the features, for example, if real-time information requires you to have a cell phone with a data plan and that kind of service, you may not have access to all of the features for all parts of the population. Okay. TNCs, partnerships, there's really quite little on this. I think that the brief only has 5 or 6 studies overall. And then we're talking about the instances where transit agencies partner with a TNC or another kind of on-demand provider to usually connect first and last mile trips, but sometimes these are also providing trips late at night, which allows, the use of transit for a trip to work, for example, and then the use of the TNC for the trip home. A lot of the studies really focus on asking people what they would have done if the program weren't there. And so it's not as easy to deduce what the VMT changes are, although some studies have found that people have reduced auto use. As far as how effective the programs are kind of in terms of extent, population density was shown to be important in terms of increasing the use of the programs, and then programs offered at a regional level may be more effective. There's a potential for these programs to further increase transit use. There's been a lot of discussion around the idea of, allowing people to give up a car if they kind of have these backstop safety nets in terms of travel. And then as far as equity, these programs can improve things like safety if they're providing connections in less safe areas where people don't want to walk or bike to access transit, or particularly at night if transit stops running. But again, like with the other features that I was just talking about, they often require access to having smartphones and data plans and kind of smartphone literacy. Okay. And then finally, microtransit. Microtransit can operate similarly to the kinds of TNC partnerships where it fills in gaps geographically and serves travelers in that way. But it also can be implemented and has been implemented in a number of cases where fixed route transit may not be performing well. So in its place, an agency decides to implement these kind of shuttle-sized vehicles that typically have multiple passengers at the same time, and it's point to point, but there's some deviation because you pick up other travelers along the way and drop them off. So lots of different models of microtransit, really depending on the geography. And again, rather than being able to directly ask or directly understand the impacts on VMT, the effects are really about how much people would decrease their driving or have decreased their driving as a result of using microtransit. And let's see. Yeah, this one study that I note here in the extent, right? Lots of factors were found to be related: employment, household density, income, all of these things relate to how useful maybe the microtransit system is, and so therefore how much people are using it. Let's see. Yeah, and then equity, I think there's some good potential benefits with microtransit in terms of just increasing mobility and then thereby improving access to different kinds of activities. Again, it does require this kind of smartphone use and digital literacy, but I think for microtransit, there's almost always a call-in option. And so there are some ways that some of these equity issues have been addressed. Okay,
Great. Thank you, Susie.
thank you.
Okay, we're going to move to Jamie Volker to talk about distance to transit, managed lanes, parking pricing, and induced travel.
All right, thank you much, Dylan.
Yep.
All right, so we'll start with roadway capacity and induced travel. Just a basic primer on what that kind of means. Basically, the induced travel effect, it's where you're adding roadway capacity and that induces or causes additional vehicle travel. And so that's called the induced travel effect, and it can be explained by kind of basic economic principles of supply and demand. So as the cost of a good decreases, generally consumption of that good will increase. And the same tends to be true with driving. And so it's also important to understand that this isn't just because roadways become less congested. Roadway capacity it can make roads less congested, and that can induce more driving. But the induced travel effect also occurs in areas with minimal accessibility or areas with unsafe or low speed roads, and that all of those reduce the time cost of driving, at least initially, because it makes driving faster, easier, or safer to access places along the expanded route. And then in turn, the reduction in the cost of driving leads to increased consumption. So increased consumption of driving, meaning it increases vehicle miles traveled. And so there's actually a large, very robust, and very consistent body of literature on the induced travel effect, at least for roadways in the class 1 through 3 range. So that's interstate highways, other expressways, and freeways and major arterials. And so what we see across these studies is a short run elasticity. So this is the effect on VMT that you'll see within 1 to 3 years after a capacity expansion occurs. A short run elasticity of 0.3 to 0.8. So a 10% increase in the roadway capacity, say on interstate lane miles in Sacramento County, would lead to a 3% increase in VMT on the interstate routes in Sacramento County. And in the long run, you see an elasticity that's even greater. And this is because there are kind of structural changes that will occur where businesses and households move, they relocate, or new businesses are created to in response to any initial changes in the incentives for driving that occur, any increased mobility that happens initially. And so we see a long-run elasticity of close to 1.0. So that means a 10% increase in capacity and lane miles will lead to a 10% increase in VMT. A couple important points here on the extent of this roadway capacity of strategy is that capacity expansions cause a net increase in total VMT. So it's not just a shift between roads. There are similar elasticities for class 1 through 4 facilities. I mentioned 1 through 3 earlier because there's more empirical evidence there. But what little evidence there is for class 4 facilities, that is minor arterials, shows that they also have a strong induced travel effect as well. Probably there's lower effects as you get down to collectors and local roads. There is still induced travel effects on all types of facilities. And another important point is that induced travel occurs in both urban and rural areas. And there isn't a lot of as much evidence in rural areas, but what evidence there is indicates a very similar long run elasticity, maybe on the order of 0.8 to 0.9 instead of 1.0. Another important point, which I already covered, is that congestion is not a prerequisite for induced travel. And then I'll cover this in the next slide as well, but HOV and HOT lanes, managed lanes, tend to have similar effects as general purpose lane expansions. Very huge equity implications from this measure: capacity expansions, displacement of often lower income residents, non-white residents, and air pollution and noise and other effects from the operation of these facilities that tend to again impact lower income households. All right, next slide. All right, so managed lanes. So I mentioned already that both the theory and the empirical evidence suggest that adding new managed lanes might have similar induced travel effects as general purpose lane expansions. A recent study by UC Berkeley researchers looked at 3 different projects where a HOT or an HOV lane was added. One was on I-580 in Alameda County, one was on I-405 in Orange County, and another one was on I-215 in San Bernardino County. And that study found that VMT on each facility increased substantially in all 3 cases. They actually estimated implied short-run elasticities of between 0.3 and 0.8, which is the exact range, as you'll remember from the last slide, of the short-term elasticities for all types of class 1 through 4 facilities, including general purpose facilities. Indeed, there is actually the possibility that managed lanes could actually induce greater VMT than adding a general purpose lane. And that would be in the case where adding a managed lane in an area that has hypercongestion is able to relieve that hypercongestion and increase traffic flows and VMT on the adjacent lanes, in addition to adding VMT on the newly added lane. On the other hand, tolled lanes could have lower elasticities than general purpose lanes, but only if they're priced so prohibitively that very few people would decide to take them. Equity effects, very similar to just adding type of roadway capacity, with the exception that you get tolling revenues from any type of HOT or a tolled road. So those tolling revenues could be used to help offset the burden on lower income drivers. Major caveat there is that tolling revenues are usually used primarily to cover the construction and operating costs of the managed lanes to pay off the debt from that construction. So there's often little left over for public transit subsidies or other types of subsidies. All right, next slide, please. All right, so parking pricing. So this parking pricing includes a range of strategies, such as increasing existing parking prices, either at the workplace or elsewhere, charging for parking that is currently offered for free, or offering alternatives to free parking, programs like parking cash out programs. Overall, there's a ton of empirical research on parking pricing, especially on the effect of increasing parking pricing at both the workplace or elsewhere. A quick note on the outcome is that most studies here look at the effect on parking volumes. So that means the total number of cars that were parked in a certain area over a certain time. So it's not just the occupancy rate. It's not like what percentage of time parking spaces were occupied. It's the total number of vehicles that actually utilize those parking spaces. There are a couple that also look at, or a few that look at travel mode choice and VMT as the outcome measure. All right, so in terms of findings, so most research, as I mentioned, is on the effect of increasing workplace parking. And meta-analyses showed, a negative 0.5 elasticity, meaning that a 10% increase in parking price leads to a 5% reduction in parking volume at the workplace. There's also a large body of research on the effect of increasing parking pricing on all kinds of trips. In general, these studies would include both commute trips and other trips, but sometimes they were parsed out to just include non-commute trips. And the same meta-analysis that I referred to before found a negative 0.3 elasticity. So a 10% increase in parking price would lead to a 3% decrease in parking volume. Parking cash out programs and adaptive have also been shown to be effective at reducing VMT, or at least a correlate of VMT, like parking volumes. For example, a study by the late Donald Shoup found that parking cash out programs in the mid-90s in LA County reduced employee commute VMT by 12%. However, there isn't as much empirical evidence on either parking cash out programs or adaptive parking pricing. There's some evidence of SF Park, that's the adaptive pricing program in San Francisco, and that's shown some reduction in auto volumes in the affected areas, but there is not as much empirical evidence there. Overall, parking pricing, I think, is one of the most effective strategies in terms of reducing VMT, and it can happen very fast. However, studies and theory both indicate that parking has, lower effects in suburban or rural areas. All right, last slide. All right, so this is distance to transit, which isn't exactly a strategy. What we mean here by distance to transit is the distance between residences and transit stations and stops, which is a key indicator of transit access. What the evidence shows here is a strong effect of residential transit proximity on household VMT. We had, again, two separate meta-analyses of multiple empirical studies that both estimated an elasticity with respect to transit proximity of negative 0.05. And what that means, what it translates to is a 1.25% reduction in household VMT per mile closer to a transit stop. The problem with those two meta-analyses, though, is that neither of them distinguish between rail stations and bus stop proximity. So we looked at a few other studies that did focus on one or the other. 3 studies looked at rail transit proximity explicitly, and they found effect size ranges from 0.75% decrease to a 4.3% decrease in household VMT per mile closer to rail stations. The lone study, we found one study that examined the effect of bus transit proximity, and that found a 1.5% decrease in VMT per quarter mile closer to a bus stop. So that translates obviously to a larger elasticity for bus proximity of bus transit than for rail transit. However, a really important point here is that the maximum distance from residences at which transit still has an effect on VMT is likely much greater for rail transit than bus transit. As you might expect, people are more willing to travel farther to access rail than bus. So it's on the order of 4 mile kind of cutoff distance for rail transit and 1 mile for bus transit. And as a result, because you have a greater catchment area, greater effect geography, the maximum potential effect of rail transit proximity is likely substantially greater than that of bus stop proximity, possibly on the order of maybe a maximum VMT reduction of 13% or so for rail transit proximity versus 6% for bus transit proximity. So double potential effect. All right, and a parting caveat here is that the actual effect of proximity to transit is going to depend greatly on the level of transit service. the trip destinations that these households near the transit stations are making, relative driving times, all of these sorts of factors, most of which are not teased out in the literature. So that remains a big caveat. All right, thank you. That is it.
Thank you, Jamie. Okay, we'll shift to Elisa, who's going to talk about land use mix or neighborhood accessibility, regional accessibility, and TOD.
Hi, everybody. So land use mix or LUM, has been advocated quite widely for a lot of strategies that are aiming to create more walkable and transit-oriented communities. So, a lot of policy strategies include land use mix. Now, it's most commonly measured using an entropy balance, which is looking at the share of land occupied by different uses in a given area. And it's often done within a bureaucratic unit, such as a tract or a zip code, but the sort of preferred method is to use dynamic buffers. And actually, there's been a lot of criticism in the literature about the way it's measured, because studies vary really widely in terms of the type of land uses they're looking at and how they're, the area in which they're measuring them. And then scholars are also sort of asking a basic question about what is an ideal mix? What are you looking for and why? Why is it better to have, X number of uses at proportionate shares within a given area, because some land uses are hierarchical and so forth. So this entire sort of area of research is sort of under scrutiny. Now, what I've included here are elasticities from those two meta-analyses. I did look at 14 studies from the US post 2000, and the range of elasticities is just really wide. So trying to narrow down to comparable studies, I looked at 4 from the US that use an entropy index, because that's not the only method, but that's sort of the preferred method, and that use dynamic buffers. And so there the range is smaller. It's negative 0.04 to negative 0.10. So many localities have adopted mixed use zoning. I did a survey a couple of years ago myself that showed 3/4 of California cities have adopted mixed use zoning, and they point to it as a very effective strategy, in their opinion, for achieving compact development near transit and promoting their own goals for VMT reduction. Perhaps the main co-benefit is the facilitation of walking, biking, and transit use, again, sort of in the whole conception of what a transit-oriented neighborhood includes. The impact is greater for inducing walking than for VMT reduction, though, probably for obvious reasons. And since low-income people tend to drive less and use transit more and walk more, they benefit from local accessibility. Some studies show that they do not tend to experience lower levels of accessibility than higher income people, and that's because of the sort of historical conditions that have ensured that lower income people do tend to live within urban areas and also inner ring suburbs. So they do tend to be in more mixed use areas. However, there are definitely there's definitely evidence that their accessibility to certain destinations, such as shopping and supermarkets in particular, is lower. Next slide, please. Regional accessibility is the ease with which you can reach destinations at a wider than local scale. And how that is defined in practice tends to be job access, often measured within a given distance or time, like how many jobs accessible within 30 minutes or within 30 miles. So that's called a cumulative opportunities index, and that's very common. I mean, an even more basic measure is distance from CBD from the business district, but especially in a polynucleated sort of economy or economic geography, that isn't all that helpful. Now, sometimes an impedance factor is also used in the calculation, which is called a gravity measure, and that discounts destinations at further distances. And even though that's widely recommended, it's rarely used. It's the cumulative opportunities measures that are the easy ones to calculate. And it's often done, in terms of jobs, but also types of jobs. So often researchers will slice out the number of retail jobs that are accessible as a measure of non-work trips, and then all jobs as a measure of potential commuting. So I'm showing the elasticities here from the two meta measures, which is minus 0.2, which is actually higher than the elasticities that they showed for most of the other of the 5Ds that are commonly considered in research, indicating that regional accessibility is really important for reducing VMT. So, all these elasticities relate to impact on VMT. And so then I tried to narrow down also. I looked at 14 studies in my report and narrowed down to 2 that employed a gravity measure, which is, the sort of recommended approach. And were done in the US recently. And so those elasticities are minus 0.10 and minus 0.13. So those might be good ones to rely on or refer to. So regional accessibility reflects the interaction of transportation and land use at multiple scales. And I say that because the sort of strategies that can affect regional accessibility may require a combination of neighborhood effects and larger. What do I mean by that? Well, for longer trips, carpooling and transit are the main modes that can compete with single occupancy vehicles. I mean, that may change. We've been hearing some predictions that, autonomous vehicles might compete. But if you want to reduce VMT through a regional accessibility strategy, then you're going to want to think about how can we improve transit use, and that requires, density and mixed use and walkability at multiple stations, multiple transit stops, sort of in a regional framework. That's what a lot of research shows, that you need to improve network accessibility, and that depends on locating, origins and destinations along transit. So basically, there is a synergistic, supportive relationship between transit and transit station areas, or TODs. And there is also potential synergy with pricing strategies that reduce driving and encourage folks to take transit. I did find research, a little bit of research on job locations accessible by auto in terms of reducing VMT. This is research done by Marlon Barnett. I haven't seen anybody else do this kind of work, but he found that jobs that were accessed by auto in entering suburban areas had the lower VMT than actually jobs accessed by auto in the central business districts or outlying areas. So I'm noting his findings. So again, in this case, we see that low-income and non-white households do not, on average, experience lower regional accessibility due to these historical conditions that mean that they're living in more central rather than outlying areas. But that doesn't mean that strategies aren't needed to ensure that transit-dependent households do have access, and that means protecting improving affordable housing near transit, which is increasingly, facing gentrification areas near transit. So the goal is to ensure that gentrification does not result in displacement of existing low-income households and households for people of color. All right, next slide, please. TOD. All right, now here, unlike in the previous two topics, my two previous slides, here we have pretty solid results because there's recent, very large sample size data on California for the impacts on VMT for people who live within the impacts of TOD on VMT. And the range in those studies for the reduction of VMT for TOD versus non-TOD residents falls between 28 and 41%, and that's pretty solid. But I do want to note that one of the real concerns about TOD research is how you define it, because a lot of research measures TOD as any area near transit, transit access versus any area that doesn't have good transit access. However, some really good research has distinguished TODs from TADs, transit proximate areas that lack those attributes that we were just talking about, in particular density, mixed land use, and/or walkability, and just a lot of land that is located near transit access in our urban areas lacks those qualities. I mean, much land near transit is zoned single family and low density, for example. And so the work that I found that compares results for TADs versus TODs shows slightly higher elasticity for between TODs and TADs versus transit proximate versus non-transit proximate. And that work also found nationally, it's a study of 549 station areas, that a full-blown TOD comprised only 13% of all the station areas.
Lisa, get you
Yes.
to wrap up so we can keep moving.
Okay, so I think I'll just wrap up there because I've already talked about co-benefits and synergies related to maintaining and improving affordable housing availability, which is increasingly important as more transit areas are getting gentrified, and pricing policies that can just encourage folks to take advantage of the travel modes that are feasible in these areas.
Great, thank you. Okay, so last group of strategies I will talk about, since I worked on these 6, and I'll try to go through them pretty quickly. Employer-based trip reduction. So these are commuter benefit, often described as commuter benefits. They could be promoting alternative modes, monetary incentives, facilities that support active transportation, flexible work hours, or even just marketing campaigns. So because there's such a broad range of these types of programs, it's really hard to compare, and it's also the reason why the effect sizes are so large here. One thing to note that the studies, depending on the unit of analysis, the effect sizes vary dramatically, right? So the studies that focus at the participant level, so if a participant of a program, their behavior change could, could be much larger than, say, the look at like regional VMT from the implementation of employer-based trip reduction, which is a much smaller estimate. So the unit of analysis is important, and which is why many of these studies can't be compared. So the extents essentially relate to the scale at which they're applied. So they're at employee centers, so how large those employment centers are, and how many are implementing them. It has synergy a lot with walking and bicycling and transit quality and access, because a lot of this is based on using alternative modes, or reducing commuting. So in terms of equity, a couple themes emerged. One, that who has access to the programs, so making sure that more employees, especially low income and communities of color, have these types of access. That state laws that require it. So we found that the studies that have state laws that require it have a larger effect. Not surprising. But then also care to consider that in many cases, especially car dependent, low income commuters, that getting them out of their car may be the wrong solution for them. So just balancing the VMT reduction, that's goal with social equity goal. So voluntary travel behavior change programs are like commuter benefits, except for softer, mostly outreach and education to, and this could be done at an employer, but it could also be done at a local or regional government. And the goal is to try to just open people's minds to alternative ways of travel, change their attitudes, to change their behavior. These reductions tend to be a little bit smaller in magnitude, but they're quick and cheap to implement, and they happen pretty quickly in terms of the effects accrued. Like the employer-based trip reduction, they're synergistic with active and transit investments, and really work well when destination accessibility is high. There's a lot of potential for social equity gains here, but the key caveat being that those communications need to be authentic and culturally specific to the outreach. And in many cases, historically, that hasn't been the case. So, equity could be a concern if that's not taken into account. So street network connectivity is a very different topic from the prior two. So this is essentially how connected a community is to the destination, to each other, and to the destinations that people are trying to reach. So you can think of gridded streets as high general connectivity, whereas lollipops and loops and cul-de-sacs and as fragmented networks. How indirect do people's travel have to be in order to get to where they need to go? So often this is seen as a proxy for the design era of the network. And right now we're only looking at the geometry and not the attributes of the network. So, um, we tend to think of, oh, gridded streets are, more connected, so we get greater access. But we're not considering the quality, say if it has sidewalks and things like that. The challenge with street network connectivity, like many of these strategies, is that it's measured in a lot of different ways, so it's really hard to come up with a unified um, change. But what we see is about depending on the type of intervention, that the range is really small, somewhere between um, negative 0.3% to 0.3% increase in VMT. So a decrease to an increase in VMT. And densifying networks is going to take a lot of time. So it's not something that can happen very quickly. And it's needs to be kind of coincident with, again, support with a lot of these other strategies that Elisa were talking about, with land use mix and residential density and infrastructure for walking and bicycling. Because without all of those things, making a city more connected can reduce travel times, and so you could have like, for example, what Janie was talking about with induced travel, induced car travel, for example. And then in terms of equity, we found very little evidence, and mostly because this is such a slow process to change street network connectivity. So more research is really needed there. Shared micromobility, we've seen a huge rise in shared micromobility services, or what I call one-way bike share, scooter share, where you can rent a bike or a electric scooter for a single trip from one origin to one destination. And these can be in docked forms, where you have to pick up and return the vehicle to a specific location. It could be dockless or free floating, where you use an app to find it. And maybe there's rules about what infrastructure you can use and where you can park the vehicle. The literature on this topic tends to report VMT reduction as on a per trip level. So we found that about half a mile of VMT reduction is occurring for every micromobility trip, on average. And that's not to say that micromobility trips are half a mile on average. They're not. They tend to be a little bit longer. But when you look at the mode substitution, and you consider things like, when ride hail is substituted, you look at deadheading of those vehicles, and you arrive at something around half a mile. So the extent of these is constrained to where micromobility services operate, which tends to be in the dense downtowns. And it's not clear that one-way shared services will really ever expand beyond those areas, because you really need, and this is where the synergy comes in, you need mixing of uses, dense residential, for these kinds of one-way shares to work. There could be, and there are attempts to make shared micromobility that look different than one-way shares, say day-long rentals or even longer lease terms. We didn't look at those. There's not a lot of evidence for those, because they don't really exist in the US very much. And there are some in Europe, but there's not a lot of research on them yet. So it could be that shared micromobility might move beyond the simple one-way share, and in which case those extents and synergies might look a little different. Evidence on equity for bike and scooter share is mixed. Some report, for example, greater access to the vehicles in underserved communities when shifting to a dockless fleet. But there's also been concerns about geofencing, the technology used to constrain where the fleet can go to, of excluding, say, low-income communities of color. So you basically have you've created a boundary, a technological boundary that doesn't allow some people to use it. So care has to be taken in those situations. There are a lot of programs have equity mandates, for example, to rebalance a certain amount of vehicles in certain target communities. And so in many cases, cities are making that a part of the permit operations for these vehicles, but it's really not yet clear whether that results in the use of those vehicles by those communities. And so, again, more research is needed to understand what it takes to make bike share and scooter share not just a VMT reduction strategy, but also one to promote social equity. Telemedicine, telehealth. This is a strategy that is not really within the domain of urban and transportation planning, but still important to consider in terms of trends for travel. And it is simply the use of information communication technology to provide healthcare services in lieu of face-to-face outpatient services. We only looked at outpatient services in this. And since the COVID pandemic, telehealth rose rapidly from a very small percent to a very large percent. So now I think we have a rate in one of the studies that was around 18% of outpatient visits. And most of the evidence in this research is on travel reduction, so not VMT, so one step away from VMT. But in many cases, researchers just assumed it was car travel. And so, if the one study that looked at a lot of cases in California suggested about 18 miles per outpatient trip. And there are a lot of these. So this is a huge, already has been a huge VMT reducing strategy, even if that wasn't the original reason for the strategy. And then there's, in terms of where we can go from here, because the rate of telehealth has actually declined a little bit and then plateaued since the pandemic. But there are a few sources that suggest there's quite a bit of potential for it to grow still, probably much more gradually than it did after the pandemic. So one study suggested 50 million additional telemedicine visits in the US per year could be made. So there's maybe some potential for this to continue. In terms of synergies, maybe there's some synergy with telecommuting in terms of people feeling comfortable with using information communication technology to access work and healthcare. In terms of equity, it's very clear that there already are a lot of equity concerns within telehealth, and it relates to VMT reduction potential. So, for example, rural residents we could reduce more VMT by getting more people living in rural communities to use telemedicine and telehealth, and yet they use it at a lesser rate. There also is some evidence that low-income patients and patients on Medicare use telehealth at a lower rate as well. And some of this may be tied to access to broadband internet, but there's probably a lot of other reasons that need to be investigated to figure out how to make this equitable, because it has the potential to do both, to improve health directly and also to reduce more VMT. Okay, last topic I think is autonomous vehicles. This is the rapidly developing technology to control vehicle driving. And we looked at some studies that looked at not full autonomous, but lower level controls like adaptive cruise control. And then some studies that examined full autonomous driving. AVs are not a VMT reduction strategy. But we looked at also like what it's going to take for policies and regulations to kind of control AV deployment to function as a VMT lever. We looked at studies that reported personally owned, and these are mostly studies are model-based simulations. So they're using some assumptions about travel behavior, some data about current travel behavior, and projecting out what would happen. Some of them were ingenious studies that used chauffeurs to simulate what it might be like to have an AV. And then and they were roughly broken out into personal AVs, PAVs, and shared AVs. And so what we found is that almost universally the studies suggested that the technology is going to increase VMT, and it could increase VMT by quite a bit. The ranges are huge because this is still being developed and deployed. But I think that the clear expectation among the research is that personally owned definitely will increase VMT by quite a bit. Shared increase VMT, but perhaps less. And so in terms of strategies to regulate AVs for VMT reduction, I think that what we saw in the literature and what we've come up with are essentially using the other strategies that we've heard of from the presentation about pricing, and could be regulations. So it could be as regulating shared use of the AVs and not personally owned, or things like that. Those are the levers that we have to help make autonomous vehicles, to help control the potential increase in VMT from them. In terms of equity, there are a lot of concerns with the technology being able to detect vulnerable road users. So some evidence suggesting that some of the biases and algorithms don't detect, say, colored skin people, children, or women at the same rates as white men. I mean, for safety, this is a huge concern. There's a concern for job loss in a bunch of different industries because of autonomous vehicle rollout. But there are also potentially some equity gains, and especially if planned well. So, for example, people that are mobility challenged to provide access to destinations. All right, so we have done a very quick overview of a lot of work that a lot of researchers have done over the past few years. And then I thought we would get a few reflections on specifically on equity in the policy briefs, and Rio is volunteered to lead the way here. So Rio, you want to say a few words?
Yes, good afternoon, everybody. Again, my name is Rio Oshas. I have a consultancy called RAOC, and I just wanted to first start off with thanking the UC Davis team for kind of conceiving an idea of having an equity panel. I know that's kind of rare in research, so I want to give you all just appreciation for that. And of course, there's still a little bit more work, which I'll talk about at the conclusion of like to say. Yeah, I think one of the biggest things that I wanted to underscore is that on that first point of planning, of a transportation planning having a history of systemic injustice, that definitely makes it pretty hard to roll out programs that will be equitable in nature. And it's definitely not a slow, immediate outcome, but a long, consistent journey to get to those equitable goals. And I say that because right from the get-go, I mean, I always want to think about all the people of the California Native tribes that have been here first, because transportation planning really has impacted them and has impacted a lot of communities too that have been either pushed out or moved out or in some way really faced that injustice kind of in broader strokes. So I think it's important to remember that history and not forget it. So I'm glad that's underscored here, because we'll need to keep coming back to that and understand that we are consistently working, and every day-to-day choices we make as we roll out new programs will impact that and hopefully help repair some of those injustices that can make it better for the communities at large. Um, and and as we were going through the CARB policy briefs, it definitely, as I was part of just some of the research out there. I know that there's other panelists on the call too. But you would see that the goals for VMT while wonderful and definitely can help mitigate some of the climate changes or the climate crises that we're already experiencing across the communities, it also is kind of walking a very tight rope because it can exacerbate some of those injustices in communities. And so the research team, you did a great job kind of pointing that out in each slide, in each of those segments. I'm really thankful for that table there. So yeah, that's always a little bit nerve-wracking to see how to strike it. And I think yeah, and then that's why the authentic community engagement is going to be super pivotal as we are looking at that. And I think it's good that we had a small panel of us, or only a handful of us that were involved in reviewing. But to make these just more adequate, really impact at the long term, we'll definitely have to include many community members from a broad spectrum of different experiences through class, ability, mobility, etc. So I hope that further on we continue to do that. Um, and yes, so low income neighborhoods and communities of color in the past and present policy decisions. There is a lot of lack of that. So again, why I thank UC Davis for thinking about bringing the panel. I think it's great. And there's still a lot of work to do because it's only just the tip of the iceberg. So again, furthering out what that panel looks like, what does it look like to really address to make sure that California Air Resources Board is putting out policy briefs that will really enhance and protect a lot of the vulnerable communities will require a much bigger panel than a handful of us. And it'll take some time to actually outreach in a thoughtful way for that. And yeah, I just like to, I guess with that, I underscore that one of the underscoring goals that California Air Resources Board should be to have equitable outcomes. And the reason for that is that if we don't really think about it in that way, um, while we may address some of the air or the VMT reductions in some areas, often what we see and history tends to repeat itself, but hopefully not, hopefully we can mitigate it this time, is that the benefits, particularly for VMT, might be very disproportionately benefiting wealthier communities who are otherwise going to, just benefit from that, and the other communities will still lag behind, even if there isn't any quote unquote additional harm being made. It may be just a disparate in how it's being rolled out. So there does need to be a more thorough uh, place to be. I think. Let me see. Yes, so the last point I'd like to make, and this is related to just the overview, the whole process for the equity review, is that in future research, I think it'll be very important to integrate from the get-go, not only an equity panel, but really a broad spectrum of other community experts coming from a variety of department and fields that can really not only look at these policy briefs, because I know these were done a couple decades ago or maybe a decade ago, but also to really start creating what the new research will need to be to mitigate the VMT reduction that will be more holistic and thoughtful so that communities don't get kind of like this different scaling where one community will benefit substantially from policy briefs like this and while another one won't. And so there is a lot of work to be done. And I look forward to hopefully in the future there's a, equity panel that's more cohesive, inclusive, and that has fair compensation for the experts and the community members that could come to really provide further research. So I'll leave it at that. And unless there's anything else to add.
Thank you, Rio. Any other researchers or advisory members want to say anything before we turn it back to John? Moses, yeah.
Sensitive mouse here. I just want to commend the panel and folks putting together these research briefs. I happen to have the opportunity to review and have some input on them. And my background is primarily in rural public transit, just so you know where I'm coming from in full disclosure. And I think relative to the equity, which equals inclusion, and I really think that oftentimes, and rightly so, rural communities have been kind of overlooked unintentionally because the focus and attention is in the higher density areas, urbanized areas. But in Fresno County, where I'm from, we have 39 unincorporated communities, 13 incorporated cities, to just give you the magnitude of the county. And it's relative when you're assessing the VMTs, especially in rural communities, because the commutes are greater. The travel times are lengthier. And also the roadway conditions are very different. So I really think that the issues at hand for future research should take into consideration, at least again, I'll qualify it in Fresno County. There are no Uber and or Lyft services in Fresno County. And you may say, why? Well, one, it's unaffordable for residents in these rural communities because the majority of the residents are in disadvantaged communities as defined by Calvin Environ Screen 4.0. So it's very costly. And then I, as a public transit operator, I'm not proud of this, but there are gaps in service. We cannot service all of the communities equitably and provide the service that are needed. The majority of the residents in rural communities, and again, this is throughout California and other states, they're transit dependent, meaning they don't have a car, they can't afford a car, it's not in working condition, the insurance is not available. And I really think that these gaps at some point in time really need to be minimized or addressed by alternative modes of transportation. And when you talk about microtransit, when you talk about car share, these are options that also would be available to the rural areas. So I say that with a little bit of bias, serving the rural communities in Fresno County. But I think some of the lessons learned from the briefs just add on there and rural communities, rural areas. And I think it would be inclusive of the overall briefs. And also it would provide a greater lens of equity. Thank you.
Thank you, Moses. All right, if there's no other comments, I guess, John, I'll hand it back to you. Oh no, it's me, huh? Oh, I forgot. Okay, so this is our we have in big bold letters draft strategy comparison warning difficult to compare strategies. So please don't take this. This is actually my attempt to color code all these strategies without talking to all the rest of the researchers. And of course, after hearing their presentations, I already know a bunch of things I'd like to change in this table, and we're going to get together and talk about how to structure something like this. But what I tried to do is just look at the effect size, extent, and the ease and certainty of the evidence. Look for this like large potential, right? Effect size with extent. But knowing that nothing acts independently, some strategies require coordination between, multiple strategies. Some strategies on here aren't even VMT reducing, and that this is really just a thought exercise to help think about strategies. It's not a recipe to prioritize one strategy over another. But you can see that first, that on the far right, that a lot of the evidence isn't very certain for many of these, and I'm sure I've got it wrong here, so the other authors will correct me when I'm wrong. Um, the ones on the top, the large extent ones that are more land use changes, they're slow to implement, difficult to implement, but they're the ones that will restructure our travel behavior in the long run. Some of them are difficult because they take a lot of time, but some of them are difficult politically, like road user pricing it doesn't have to take that long, but of course, politically, it's very difficult. But the easy things, and by easy, they're still not that easy to implement. They're usually the smaller extent topics. So we have this real challenge with the strategies that we have available to us being that the ones that are going to do the most are going to take the most, and the ones that are, not going to do that much, they may be a little easier. But I think the future is that we need to do them all in some degree, right? It's not about selecting some and not doing others, but it's about the combination of which ones you use and where. And then some of them can be pretty rapidly, so I bolded the ones um, that might be, you know, important for meeting, for example, 2035 targets. And not that the others shouldn't be thought of in the same vein, just that the expectation is that they would take quite a bit longer to reduce VMT. Okay, so this is essentially just a teaser, and hopefully in the coming weeks we'll put something better together on the strategy comparison table. All right, now back to John.
All right, thanks, Dylan. Yeah, thanks to you and the researchers and the equity advisors for all this great work. And now we're ready for question and answers. We have already had a really good conversation in the Q&A function. I don't know if anybody's been looking at that, but you can see the ones with written answers already there. I've enabled the raise hand function as well, so if people want to ask a question live, but I would say let's start with the unanswered questions in the Q&A, if that works for you, Dylan, and maybe I can read them out and then you can direct them to, or people can jump in for wherever they should go. Does that sound
Sure.
good?
Sound good?
Okay, yeah, our first one there is, did you include paratransit services in microtransit? Also, did you distinguish between more shuttle types versus more rideshare small car types? Microtransit seems to be a bit of a buzzword that means different things to different people. Some services provide paratransit and non-paratransit, whereas some are strictly paratransit.
As far as paratransit, no, we tried to differentiate between looking at microtransit or on-demand service that really is paratransit for specific groups of travelers versus microtransit that's available to everyone. So the aim here was to look at microtransit services that are available to everyone. With that, but as far as the types of vehicles, there's a huge variety in the types of vehicles, and I didn't look at that, but yes, like the aim of all of the services in the studies, to the best of my knowledge, is that they were all, allowed for shared rides, so multiple passengers in the vehicle at once, not, which is distinct from the other brief about the kind of T&C partnerships, where that would be sort of a single traveler or maybe a group of travelers who are all traveling together versus multiple passengers who are strangers to each other being picked up and in the vehicle at the same time.
Okay, all right, thank you. I think it looks like Jamie was answering another one about the people dropping off their kids. So I will go on then down to, do all the policy briefs look at costs and cost effectiveness?
I think I can generally answer that to be no. Most of the studies are not studies of the costs and cost effectiveness. And in some cases, literature talks about the costs for certain strategies. And so we thought of it a little bit broader as the kind of the ease and the extent. So cost would be considered in there, but it really depends on the strategy and what literature we found. It would be a nice idea though in the future.
Okay. Our next one is, for all the policies shown today that requires the VMT quantification, what model is used? Are those numbers based on research studies or the travel model results?
So there's no specific model for any of these. These are research synthesis documents. So we're just reading existing studies of these strategies. So So it really depends on the strategy. Some could be model-based results, some could be empirical analysis of data, some even experimental analysis, or some could be cross-sectional data collection. So it really depends on the brief, but there's no unified model that any of this is coming out of.
Thank you. Okay, can you add the numeric sizes, effect sizes to the color-coded table? If so, it would be very helpful. So it's going to get bigger.
Yeah, so I hesitated originally, and we'll have to talk about that. The problem with the effect sizes is the interpretation. So as we pointed out, the units are different in the outcome. So what outcome are you measuring, and what are those units? The units are different in the target intervention, and so since we can't unify them, it might be misleading to put effect sizes, unless this table gets really, really big and we put in, here are the units and here are the effect size, but then it doesn't become a strategy comparison anymore. The other thing that we want to guard against is people using a reference table and not reading the briefs. We really don't want that. We want people to read, they're not very long, and reading the briefs is really the what needs to be done if you want to learn about what the evidence suggests, because there's a lot of nuance in the results that it can't be communicated in, an elasticity. But I get that that's what you need. So it'll have to be a balance eventually.
Thanks. Okay, so and I think Jamie already answered a similar question or previously, but I'll just say this one here we have regarding the induced demand policy. Have you considered the RCTF Rural Induced Demand Study led by NCTC? Has there been any changes on the elasticities in the NCST calculator for the rural highways?
Yes, I pointed out in response to an earlier comment that study is not empirical. It's basically a critique of the calculator, somewhat performative, doesn't have a lot of scientific rigor. We are reviewing that, providing for another project with CARB, actually, and so we will have a report out that responds to the Rural County Task Force report, reviews it, and gives objective feedback. I would also note that if you look at the NCST Induced Travel Calculator, the guidance on the website says that it applies only in urbanized counties. So that's currently what the guidance is. I did mention in my presentation, though, that what empirical evidence we do have, for the most part, indicates that the induced travel effect, the elasticity, is quite similar in rural areas as in urban areas, both in terms of rural counties, rural areas, and then also non-urbanized portions of a metropolitan statistical area. So in my previous response, I cited two studies that show that. And I would say, though, that I mentioned in my presentation, there is not as much research on rural areas. And so that's a huge area of need. I would agree that we should have more studies that look at the different contexts in terms of the induced travel effect. And so we are actually working on that at UC Davis in partnership with folks at other universities and consulting groups and other folks. So more to come on that, but currently as it stands, we have not changed our elasticities on the induced travel calculator, certainly not based on the Rural County Task Force report. But as new evidence comes out, we of course do take that into account and update our calculator accordingly. Thanks for the question.
Great. All right, thank you. I think this one might come back to you again. It says, I'm curious about rebound effects, i.e. backfilling, discussed in the recent study by Millard Ball et al. Road expansion is a fundamental cause of growth in vehicle travel, and it gives a link. Could you talk a bit about the implications on the efficacy of these strategies?
Yeah, backfilling is a huge issue. And it isn't something that we've thoroughly studied for most of these strategies. So I think that's another area of immense need for research. Um, and I would say the biggest issue here is that if we keep expanding our roadways, we keep making it easier for people to drive, that's going to keep making these other strategies less effective. So if we were to stop building roads and focus on the other strategies, we might not reduce our overall VMT a lot. It could stay the same. We have the same road capacity, but what you're doing is by providing these other strategies, you're allowing for additional accessibility, additional mobility for more people. And so, the percentage of total personal miles traveled over time would shift to other modes if you are holding your roadway, your driving capacity constant. So that's kind of, I think, the biggest issue there is really what we're choosing to finance. If we keep financing roadways, you're not just going to be able to mitigate that with transit. You're going to have to really either price the roadways, or you're probably going to have to stop building roadways and start pricing them to have a reduction in total VMT. But VMT per capita should go down, assuming you are increasing all of these strategies that we talked about that could reduce VMT.
All right. Okay, thank you. Okay, the next one is, will we participants receive a link to resources? I didn't see links in the meeting invite and missed the first part of today's presentation. Thanks. Yeah, great. You could catch this part. I just put the link to the Policy Briefs webpage in the chat. And my email address is on screen right now. So if it may take us a few weeks to get the recording and the PowerPoint online, we'll have to make it ADA accessible and everything before we can put it online. So the PowerPoint, that is. So if you would like me to let you know, just send me an email at this email address, and I will email you directly when the PowerPoint is up and the recording. The next one is, regarding the table, you might consider adding elasticity to VMT unitless to the extent that information is available.
Yeah, thank you. Well, second that first comment. We'll think about it.
All right. And then our last one here, and I note that I tried to allow people to raise their hands. We don't have any raised hands that I'm seeing. So if you're trying to raise your hand and it's not working, I guess type your question into the chat, into the Q&A function. But otherwise, this is working out, I think, pretty well. So the way we're doing it. So either way works. The last one here is, how would someone translate the findings in the policy briefs when assessing the outputs of a regional travel demand model?
A good question. Susan, do you have any thoughts on that? Sorry to put you on the spot.
Yeah, I think that's a little complicated. I mean, the travel demand forecasting models sort of inherently have an elasticity or imply an elasticity. And so it is possible to compare what that implied elasticity is to the kind of elasticities that we have found in the empirical literature. And in fact, CARB does an exercise like that when they're reviewing some of the sustainable communities strategies analyses. So I'm not sure. I want to say more about that. I don't know if John wants to chime in about that. And then some of these elasticities get used for, or can get used for off-model estimates to look at the effect of strategies that are not built into the travel demand forecasting models.
Yeah, I think on my account, I would say, yeah, it's very complicated and it really varies by the strategy. CARB uses the results of these studies or the policy briefs in a variety of ways. When looking at the sustainable community strategies or even having other conversations and looking at the technical methodologies that underlie the sustainable community strategies. So we use it as a general resource, but yeah, it's not a simple answer to that question. So. We have another question now here. It is there any research on the effect of reducing travel lanes or removing highways on VMT, traffic evaporation?
Jamie, anything?
Yeah, there is some evidence on that. Most of the research that looks at induced travel that we rely on for the NCSC calculator, for example, um, is network wide. It's very, multiple years of data across many different geographies, and it's as network wide. So the units of analysis are usually county, an urbanized area, metro area, state, something like that. So it captures the entire effect across the network, not just on the facility itself. The research I've seen on removing lanes, road diets, or otherwise, it does indicate that there is reduced VMT on that specific facility. And there have been a few studies I've seen that attempt to look at the effects on adjacent roadways too, where people might be diverted if they are stymied because there's fewer lanes on the road they want to travel on. And those studies as well, a lot of them are from Europe, indicate that there is a net reduction in VMT across the roads that were looked at.
Great. All right. Thank you. Thanks, Jamie. So I think we have no more questions and no raised hands. I saw one raised and then it was put down, so I think that it was working. But all the questions have come in written. So I think that's Dylan, did you have any last words or?
Just thank you to everybody. This was
Okay.
a big group effort, so thank you everyone for everything. I've never done a project like this, so thank you for helping me make it work.
Well, I see Santosh Bhattarai has raised his raised hand, so I will allow you to talk. Try to.
Thank you, John. Can you hear me now?
Yes.
Okay. I was just trying to understand the outcome of this workshop. So, any update on the policy side? Is that going to be used by the CARB, in the process of the SCS strategies evaluation? And the MPOs needs to be, following this, like, or within this policy framework, whenever we use that strategy for our SCS. Kind of like understandable, or I think that's what it is, but I just wanted to confirm that that this policy update will be used for the 2026 SCS evaluation.
Yeah, thanks for that question. And I guess like the previous one about the travel demand models, it is very complicated. So this will be, I'm sure, one of the resources that we'll use. And given that it's based on a lot of the most recent research and kind of a comprehensive look at a lot of these subjects, it will have a lot of weight. But of course, a lot of these things are conversations about the quantifications of certain strategies and how things go. So I would say it's going to be one of the new sources and probably a very important one. But it wouldn't certainly wouldn't be the only source.
Yes, I mean the area wise, the modeling, whichever strategy can go through the modeling process would be different than these empirical studies or the results. But yeah, thank you for answering that.
Sure. Yeah. Thank you for coming today. So, all right. Well, with that, oh my, we have several new questions here. We're at 2:56. Maybe we can go really quickly. If people are still on, we want to leave at 3. To what extent do you think the policy briefs are applicable to other states beyond California?
Generally, I think they are applicable. You'd have to look at the specific brief, but a lot of times even though we're focused on generalizable information for California, we drew from all over the country and even all over the world if necessary. So I would just say dig into each brief and see where the studies came from, and that would be my first recommendation.
And then I think that we'll just have to call this the last question. It's the last question we currently have, and then we'll wrap it up. So is the takeaway from the managed lanes finding that they don't reduce VMT as generally implemented?
That's a great question. And so I want to clarify that the evidence I was looking at, our brief focused on adding new managed lanes. So this would be not converting existing lanes. If you're converting an existing lane, then the jury's more out on that. But if you're adding a new lane, adding a new managed lane, then yes, the takeaway is that it is going to induce VMT. How much will depend on exactly how that facility is managed. If it's priced prohibitively, like I mentioned, it might not induce VMT that much. But for the most part, it'll probably, based on what we've seen empirically, and which we also need more studies on, and also what theory would suggest is that the effect is pretty similar to adding a general purpose lane.
All right. Thank you, Jamie. And all right, so since Dylan's already said his thank yous, I'll say mine. Yeah, thank you to everybody, all the researchers, the equity reviewers, the reviewers at CARB and other state agencies who worked on this. And thank you for everybody for coming today. And so we hope to have today's PowerPoint and the recording of this session on the Policy Briefs webpage in a couple of weeks. The final briefs themselves are already, or some of them are already on there, and we should have the final ones up there in the next few months. And some of the new ones, as I said, are already there even today. So thank you to everyone for coming today, and have a great rest of the afternoon.